hollowing in this area here. And so we did some injections to just create a smoother contour on both sides of her cheeks. We also did a little bit of injecting in her chin because her chin was kind of small for her face and a bit recessed. A little bit of work on the jawline. And we have also treated Christina's lips in the past. She naturally has quite thin lips. And so she wanted something that was still very natural in keeping with who she is. And so more or less what she got was a bit of hydration and just a smoother lip. The other thing to note is that Christina has a little bit of a lip asymmetry actually, and she's kind of been self-conscious of it in the past. So we've been able to make improvements to that, but we can't remove it completely. With injections, that's kind of our goal, is to create some symmetry and acknowledging that we're going to work with your personal anatomy. Okay, so if you're ready, then I think we'll just get started on the injections. Okay, so like I mentioned today, we're going to be using Dysport, and it is the same neurotoxin as Botox. It's my preferred product, to be honest. I just find that it gives really natural results. I find it's very predictable, and it seems to create a smooth appearance just from my personal experience, so that we don't have areas that are overly, quote unquote, frozen, and then areas that have more movement. And always my goal is to just soften lines, never to make it so that we have areas that are completely immobilized. Okay, so I have actually already cleaned Christina's skin off, so I'm happy with that. And another thing I like to do is, generally speaking, I will mark out where I'm going to inject with just a little white eyeliner pen here. I just think that it helps me stay on track and really make sure that everything is full. Additionally, if we're doing a little bit of teaching during our appointments, and I like to sort of know what I'm doing and why, then it gives me a good visual to give them the mirror and let them see exactly what we're doing. So if you frown for me, Christina, perfect. So we want to get this little muscle here in between her eyes, and if you can see, she's quite strong here. We can almost see her muscles, and so we know we're going to inject in the head of that muscle, kind of right about there. And then if you smile really big for me, we've got just this kind of a sun or a star pattern here. So we really just want to treat all the way around so that we kind of soften the whole area. And again, just using very small amounts just to create some softness.
So one of the things I actually really do like about is that kind of the lines, right? So I never want to actually have them disappear. I just want to soften them. So that's something that I should have a concern about?
No, but great question. So I'm not going to be heavy-handed. I try never to be heavy-handed with anybody, because always be able to add more. If we do too much, we can't take it away. You really do have to wait that 3 months for the product to wear off. And people are unhappy that way. On a rare occasion, people do have to come back in 2 weeks and ask me for a little bit of a top up, a couple of units here and there, and I'm very happy to do that. And I think for the most part, clients are happy to do that as well, as opposed to the top. So I will do a series of it. I'll keep the quantities very small. Okay. Good. And then something else Christina mentioned was this little line here. I don't know if you can see it on camera. When you frown for me, let's see if it shows up. No, but anyway, this little injection, I should have mentioned it. It'll help with right over here.
So I've noticed in the last couple of weeks, actually, I've started getting like a line straight across my nose, which is new. So my 11s have become, I guess, like a U.
It happens to the next of us. And then I'll just sort of talk about marking out your chin. So if you can pout your lips at the camera, you can see she gets a little bit of dimpling in the chin. And the reason for that is that the muscle is kind of curling up and contracting. And although it's not really severe on her, it's just a quick and easy little treatment that we can help that muscle in the chin there relax so that we don't get that dimpling. And, people are noticing this more and more, I think, working from home and being on Zoom calls and seeing themselves express right back to them. So this is something that, more people are sort of noticing from what I've seen anyway. Okay. And did we decide that we wanted to treat your forehead today as well?
I've never really had a huge concern about my forehead, but again, over the last, few months, probably I've started to noticing a little bit more creasing on the forehead. Not a big concern for me yet, but I think it's starting to become something I'm noticing more.
Okay, so then we could just do a little bit of kind of sprinkling. I like to kind of hide the forehead. And why we'll do that is just for more preventative reasons. Not super worried about it right now, but maintain that. And, I think if we're going to treat this area, this third half of our face, it really works together. So it's nice to, not just treat one area, but like I said, globally kind of smooth things out. And that's a great point. So someone just mentioned, now that we're wearing masks, what are we seeing? The top half of our face. Yeah. So again, just a couple quick little markings. And, at this point in time, if you're doing an appointment, I would probably take a before picture for you. And we just keep that on file. We wouldn't show that to anybody, but, just so that we could always compare before and after. Okay. I haven't had any questions just yet, but I welcome questions, so don't be shy. You can just type it in, and I'm happy to answer anything. Okay, so I have everything already set up. Now, another thing is this is just a teeny little needle pointer for what this is going to look like, but in this case, this is just the smallest, thinnest needle that we can really work with. And so, although it's not comfortable, it shouldn't be painful. And Christina can talk to you about that in a second. So, little poke. How you doing?
Excellent.
Great. And we'll just go right in here. Turn towards me just a wee bit. Perfect. So now we have treated the lines in between her eyes that quickly. So it's very quick, very simple, and
very minimal. Like you can feel the initial kind of poke, and then it dissipates almost instantly. Although it depends on areas. Like to here that I buried, and then this one had a little bit more spice, but still, gone.
And that is. I don't really know why. There's just, some little pokes hurt more than others. It doesn't mean that anything is wrong or right. It's just, I don't know, just the nature of the business. So, a tiny bit of redness, maybe just this very minimal swelling at this exact moment. This will all dissipate in just a few minutes. This won't last for long at all. And then Christina will start to notice that her treatment is working within about 3 to 5 days, but we say that the full result is seen at 2 weeks. So if there was ever any concerns of asymmetry or, like I said, wanting a little bit more of a treatment, 2 weeks is the right time to follow up for things like this.
There's a question with a client who just tuned in a little bit late, and she's asking if Christina has had injectables before. So maybe you could just circle back.
Sure. Yes, Christina has had injectables done before. She has had the treatments we're doing today. She has had them done in the past, but she has not had anything in a number of months, more than 3 months. And generally speaking, this type of treatment with a Dysport or a Botox product, we would recommend you come about every 12 weeks. And then additionally, like we just mentioned a little bit earlier, Christina has had some filler done in her cheeks, in her chin, and we did some filler in her lips just for a little bit of a hydration. And Christina really appreciates a very natural result, and I think that that's exactly what she has. Okay. So now just moving on to your eye area. So if you just turn for me that way and squint your eyes really hard, perfect, and relax. So these injections here are just really superficial. We're not going deep at all.
So of all the areas on my face, my crow's feet are the most important to me to maintain that natural smile or talk, that expression.
Okay. So we won't get rid of them completely. We'll just soften them and just, like I said, just do that sprinkling all the way around. Because what we don't want is no movement here and then additional creasing here, or nothing here and more creasing here. That'll be a telltale sign that you've had something done, and that is not what we're going for.
And I think too, like that shows you show so much warmth
Yes.
in those areas, and so just minimizing it so you have it just lessened a little bit, but you still can emote that warmth out when you're interacting, I think is incredibly important to me personally.
Yes, because you're one of the nicest people I know. So, so far so good. There is a few risks, I guess, with this type of treatment. One of them would be bruising. Of course, I am, putting little holes in the skin, and, we are injecting, so there is always a chance of getting a bruise. They're usually very small, just based on the size of this little needle that we're using. And then, more complicated would be an eyebrow or an eyelid droop. And I do mention it just because I think people need to be informed that it is a possible risk. It is a very low chance, and the injections I've done on Christina today, I'm not really worried about it at all, to be honest. But I guess, in terms of what are the complications, that would sort of be some of the less desirable. We usually recommend too that after treatment, you stay upright for 4 hours and avoid exercising for 24 hours. So in addition to not wanting to get a bruise, the other reason we say that is because I'm putting a liquid in a very tiny muscle, and we really want to try and keep that product exactly where we've placed it. Because some of the complications I mentioned, drooping eye or eyelid or eyebrows, right, can be a result of product migrating out of where you intended to put it and migrating into another area. It could also be improper placement from the get-go, but it can also be that migration. So that's just why we make those recommendations.
I have one more question. Okay. Has Christina noticed changes in the way her skin reacts? Were the complications of bruising worse the first time you had it done? And has it gotten better?
I've actually experienced very minimal to no bruising or swelling, to be honest. I'd say out of any of the treatments I've had, the most was probably when I did the filler in the lip, but it's a bit more of a sensitive area for me personally, especially. But it was still minimal and not noticeable. And, being able to put some mineral makeup on to cover that up. When I've done some of the larger areas with filler, we've used what's called a cannula, and it's quite a interesting technique. Carly can probably speak a little bit more to it, but I found it very comfortable, almost to the point where I could sit for 45 minutes getting a filler treatment and have a nap. But yeah, I could probably let Carly speak a little bit more about what that technique is.
Yeah, the cannula technique is great. What it requires is that we make an entry hole, and then we insert what is more like a very skinny straw into the skin. And the reason we use cannula is because it is a blunt tip as opposed to a sharp tip like a needle. So it's safer, never 100% safe, but the idea is that it would move past any vessels. And the biggest risk with filler is if we get the product into a blood. That's our greatest risk. So whatever we can do and techniques we can utilize to avoid that is the best choice, generally speaking. There is area that a needle technique is warranted. So, not only cannula, there's other ways of doing things. But yeah, that was something that we did do with Christina. And the other thing to note is that the hyaluronic acid fillers that we use from both Restylane and Rabanesse, they have a numbing agent in them. They have some lidocaine inside the product. So the most discomfort is just at that very beginning when we do that first entry point, and then that numbing starts to set in pretty quickly, and people are generally quite comfortable.
Does the product line that we use for lips have any of the numbing?
It does, but lips are so sensitive that we have a lot of nerves there, and it's just such thin skin. It's a very delicate area, so the lips do tend to hurt probably more than most areas. We do have numbing cream, topical numbing agents. I find they work quite well. Some places might use injectable lidocaine to fully block you, like at the dentist. It's not my preference. I don't do that. I think that sometimes it distorts the natural anatomy, so I try and stay away from that. Excellent. Okay, so we'll just do your forehead really quick, just so that I can kind of show people how easy that is. The forehead is actually trickier than you might think, and the reason for that is it's a lifter muscle. And so what we don't want to do is put too much here, and then we get a droop and we get a really heavy eye. especially people who have a deeper set eye or small eyes or maybe a bit of a hooded lid. And so to avoid that, I like to just keep my injections high. And on Christina, we're going to be just, just like I said, a sprinkling just based on what her needs and wants. Just a little bit.
This is the first time I've ever done my forehead, and that was probably the least amount I felt. Because I find here for me is probably where I feel it the most. Eyes, surprisingly, you think would be more sensitive, but not bad. Yeah, but here it was barely felt it. And I have no numbing anywhere on my face for when we do any of the neuromodulators.
Yeah, or neurotoxin. Yeah.
But if we ever do anything kind of down in this area, I usually do put some numbing cream in that spot. But yeah, that was incredible.
The downtime is also minimal. Like I said, already you can see that redness is subsiding, and aside from not working out for a day, which if you needed an excuse, I'm happy to give it to you. There's really not a lot of downtime with this. You can, do your regular routine starting tomorrow morning, put your makeup on, and it's all good to go. So Christina, get this spicy part over. Do your upper lip, just to show people that it is possible to do a very teeny amount in the upper lip. We call this a lip lift. It is not the same as putting filler in your lip, but our mouth muscle is a sphincter muscle, and so it's designed to squeeze in around the mouth. So by doing a little bit of treatment here, we almost create this little bit of an effect that can sometimes just loosen it up a little bit and give that little bit of a lift. Christina has had this in the past, and she likes the results. It's just 4 little units, so it's not a big investment of time or dollars, so why not?
There are a few disclaimers, though. So I've been doing this lip flip or this lip lift for probably 2 or 3 years. And the reason I like it is because I do have a really naturally thin lip, and it's also kind of a bit narrow. It just gives it that appearance of being a little bit fuller without being super noticeable, but it does help me with my confidence in my smile and just my appearance. But there are a couple of things that I've noticed, and probably the first couple treatments really had to be aware of brushing your teeth sometimes, because you lose a little bit, like you don't lose your movement. You're able to speak normally. People don't notice, but because there is a little bit of that relaxing of the muscle, brushing your teeth, you just have to adjust your technique a little bit. Straws can be, you might kind of lose a little bit with a straw and drinking out of a glass. But I found after the first couple treatments, I kind of adjusted to how I was functioning with those things. And other than that, I've had really no issues. But there is some things to kind of be aware of, because you are relaxing the muscle a little bit. But again, as Carly said, you're only putting so few units, and you're not really limiting the movement, the natural look, how you speak. So just if you are thinking about having it done, it's definitely good to come in, have a chat with Carly about, what some of the after might be like for you.
100%.
Okay, we just have a quick question before you do this. What is the price range for injectables?
Okay, so the Dysport or Botox products are $10 a unit. And generally speaking, for first timers, we're looking at between 25 and 35 units per treatment. That can vary absolutely, but that would just be my average, sort of the median. And then for any hyaluronic acid filler, it's $650 for a syringe. And one syringe can often be a good place to start. But lots of times what we want as an outcome needs to be done in stages. And so you're a great example of that, because we did cheeks one time, or lips another time. And so we can certainly do more than one syringe at an appointment. But I find that people are usually kind of around the 1 to 2 syringes per appointment. And then, come back and see me in 3 months, 6 months, and we'll kind of reassess and do things gradually. It helps to provide a really natural outcome, but also I think it's kind of nice on your pocketbook too, if that's a concern, and it just allows you to sort of budget and spread things out a little bit more.
Do we have any kind of, if you purchase or get treated with more than one syringe of the filler, is there any kind of pricing difference? So if I got 6 fillers versus 1, I'm not 6 yet, I'm still at 2, but.
Yes, there is. So $650 per syringe, but the second syringe is $600.
There's a term for those little white spots that can appear inside the lip. I'm not sure what it is. Is there a risk that lip application or modulators results in those showing more due to conversion?
I would say generally no, because again, this is a very subtle flip of the lip, and it really won't kind of show the underside of the lip all that much. I wonder if those little white dots, kind of hard to say if they're related to previous filler, maybe. Sometimes that can happen. You can get some bumps if the filler has migrated or been injected a little bit too closely to the wet part of the lip. But generally speaking, no. Okay. So like I said, we have cleaned your face once before, but just to make sure here, I'm going to do this nice and quick. Two more and you're done. Hooray. And again, this is also very superficial injection. It's just really close to the surface. You all right?
I'm all right.
Okay, good. Awesome. So another less commonly injected area is the chin, like we mentioned, and this is also, it's one of my favorites because I think because I really personally have that dimple chin thing and I don't like it, but also because I'm just going to do 2 units on either side here. It's super quick and it's very effective.
So if anyone's new, I don't know if we've had anyone new since we chatted about this earlier, so I'll pucker.
Yeah, and you can kind of see it. Like I said, Christina's not the worst offender of this, but she does have a little bit of that dimpling in her chin. And so, we're making little micro improvements here. But that's what this is all about to me, is just improving your already existing beauty, right? Little poke. And a little poke. Super easy. So you can see here, there's one little spot that's a little bit red. I don't think it'll bruise, but just for an example, that's not abnormal. You can expect a little bit of a mark there if we've poked you.
And you can apply ice to help.
Oh, for sure. Yeah, 100%. Yeah.
Is there anything that I'd want to be doing after receiving a Dysport or a Botox treatment, as far as like movements or anything that I can help to have the results that I'm looking for?
Yeah. So oftentimes, in addition to telling you not to exercise and stay upright for 4 hours, we'll suggest that you do some exercises of raising the eyebrows and frowning and trying to work those muscles. It's not wrong. I think that naturally people are pretty expressive, and so I think even if you forget, you will naturally probably do many of those movements. I haven't seen a huge difference in result for people that do their exercises and don't. So for me, it's not a deal breaker, but yes, it is something we can talk about during the pilot.
Okay, one more question came through. Mispossession on microneedling, but I'm also interested in that. When the 2 procedures complement each other, should one be done before the other?
Great question. So the question was about microneedling and a Dysport Botox filler type treatments. Do they complement one another? Yes, they certainly do. And should they be done together? Not quite. So we should allow 2 weeks in between. It doesn't really matter which treatment you do first, but always allow that 2 weeks to heal. So with any kind of neuromodulator treatment, we say final result is in 2 weeks, and that is actually the same timeline with filler. We say the final result and the way it's integrated into your natural tissues is 2 weeks. So we should allow that time in between appointments. We don't want to inject into irritated skin or skin that's healing. If you have any wounds or any, psoriasis or something that's active, that's not a good time for any kind of injection.
I should mention actually too So I'm someone who actually gets cold sores. So when I'm doing anything in the lip, so a lip flip or any fillers, I actually have a prescription for cold sores that I actually will take before treatment and then a few hours after treatment. And so for me personally, I haven't had any issues by kind of following that regimen, but it's something to know as well that there is that.
It is very common to get a cold sore after lip injections, especially with the filler. So that's great advice to actually just secure that prescription from your physician beforehand. Yeah. Okay. And so last but not least, we wanted to sort of address this area on Christina where she feels like she's got a little bit of a downturn of her mouth. And so if we can stop this from pulling down, then what will happen is these muscles will continue to pull up. And the hope is that we just have a slightly happier looking mouth when it's at rest.
And so is that something, because I feel like I've always had that, but is that something that's kind of more starts to happen with age as well, that you start to get a bit more of a downturned smile?
Yes, you do. And there's a number of reasons that happens. Genetics, for sure. But also we lose our elasticity, we're losing collagen, and we're losing the fat pads in the upper portion of our face when we age. And that sort of globally happens to all of us, unfortunately. So we lose volume here, which is why a strong cheek is always important. And we start to get volume here where we don't necessarily want it. So, lots of times people will sort of see a little bit of a bulk here and then a bit of a void here. And so, that would be something that we would treat with filler. But overall, you've got a great jawline here. You're quite straight and smooth.
That might be the filler that Carly put in. So it'd be like, it goes back to that question with the microneedling, or when you're doing any kind of a laser rejuvenation treatment, when you mentioned that loss of collagen or elastin, so you're helping to promote your own body's natural production of collagen and elastin to help start getting that fuller lifted look, and then using the Botox Dysport filler to help. Yeah,
that's very much the case. It's kind of like, if you just eat healthy, that's great. But if you eat healthy and exercise, it's better. And so it's sort of how we got to think about it. You got to kind of approach it from lots of different angles. Okay. Now, I didn't just mark out quickly here where we're going to inject here. Can you frown for me one more time, just to make sure that I'm happy with my face? And do that sad mouth. Come on, bring those lips down.
I'm really bad at doing face movements.
Everybody is. You're not alone. There you go. So these injections actually, they can be a little bit trickier, riskier, because we've got a lot of muscles in the lower part of the face that are affecting our mouth and the way that it moves. And also a lot of the muscles overlap here. So, we want to be careful to get the exact placement and the right depth and things. Again, we've had this before, and we've always been successful in achieving what we want. But it is good to know that that this is sort of a less common injection with this type of product. And again, just a very tiny amount.
Thank you. That's great smile and gloves.
Thank you. Give me 3 to 5 days. The smiles.
So if we weren't talking, this whole appointment would probably take, 15, 20 minutes. And the another thing I should mention is there's lots of people out there that, they think, I want something. I don't like the way I look, or I'm looking older, but they don't know what that something is. I'm very happy to see anybody for a consultation here at Bliss. Consultations are complimentary. And so, if you just want to ask me anything specific about you and your face, your history, I'm really happy to kind of sit down for 15 minutes and we can come up with a plan.
Question about what about under the eyes?
Question about under the eyes. Okay, a few things about under the eyes. So, first of all, the reason people are unhappy with their under eye area is usually one of two things. One, they have a dark skin under the eye. And if that's the issue, that it's a dark pigment, then what you really should start with is like a lightening serum or a lightening cream. And Bliss offers a wide variety of great products. So that would be something. If you have maybe some darkening under there, but a physical hollowing, so that you've lost some volume under the eye, and the reason that your eyes look tired or dark is because it's actually catching a shadow there, then what we would look at is filler under the eye area. And the reason for that is we need to fill that space and we need to bring that skin up a little bit to create a more, like a smoother appearance and to even out that hollowness. So for under eyes, I love doing them because I think they're so rewarding and people are so happy with the results. Like you said earlier, your eyes seem to really share a lot of that emotion, and so it's something that people really focus on. Generally speaking, I will do a little advanced nipple here, and then I will use a cannula technique to reach the under eye. And again, that's just to be as careful as possible and respect the fragile nature of this area. It's very thin skin, it's close to a lot of important structures. We want to make sure that we're not affecting any lymphatic drainage here and doing any damage. But occasionally I do actually also take a teeny tiny syringe like I just showed you, and we'll kind of go right on bone just to kind of fine tune things and really be specific in our placement of product. Is it risky? So I would say it's not any more or less risky than any other filler type injection. There's always risk with anything that we do. Although the risk is very low, there is a couple of complications that could be significant. So as I mentioned earlier, any kind of bruising, bleeding. So, it's not ideal, but a bruise can heal and it's not harmful. The biggest risk is if we get the product into a blood vessel and we plug off that blood vessel. So that's the risk. Now, we always have hyaluronidase on hand, quite a bit of it. And hyaluronidase is a substance, an enzyme that dissolves filler. And so that's kind of our rescue if we need it, if we ever run into trouble, that we could dissolve the filler and restore that blood flow would be the goal. But again, very low risk of that happening, but I always want people to be informed.
Sounds like you know what you're doing.
I have actually a question about coming in for a consult.
Mm-hmm.
I know when I first kind of started on the journey of going into injectables, I had actually 2 consults before I actually did anything, just because I wanted to. I like to ask a lot of questions, and I mean, you want to make sure that you're comfortable with what you're doing to the look of your face. Could you book a consult and still get the service? Like, could you do a 15-minute consult and still get the Botox or the disc work service?
Oh, 100%. So if you think that you want to proceed with an appointment, then it's best just to book the consult and an appointment. So then that way, they'll book you for like a 30-minute time frame, and then I would absolutely, be happy to do the consult and the treatment the same day, provided there's enough time. Absolutely. And if you decide not to move forward with the appointment, then I'm not offended either. So no risk.